So what are you going to see when this happens? So this is something that's definitely applicable to you guys for sure. You have swelling over the midfoot, so it's going to be swelling across the middle part of the foot. You're going to have boggy swelling that you'll see, like some bumpy swelling on the bottom of the foot. If you start to manipulate any of those joints around the foot, they're going to be painful. All right. You can see they may have a lot of movement in their big toe. If a lot more movement, that's normal. You'll see it right away. If you ask them to go up on their toes, they may not be able to go up on their toes because it may be too painful. They may get pain with, if you take the front of their foot and you actually move it and twist it a little bit, they're going to have a lot of pain with that because it's going to have a lot of excessive movement in that joint. And the low energy injuries, the ones that where you plant and twist, can produce little or no displacement of the toe. So you may not see any excessive movement on the toe, and it might just be like, well, it's just a little bruised up, just, you know, that looks okay. So we're going to look at X-rays now. So what they look at when somebody comes in with a suspected injury is they're going to look at a front to back X-ray. They're going to look at a lateral X-ray from the side, and they're also going to turn a device at a 30-degree angle and look at the outside of the foot from a 30-degree angle. It's that 30-degree angle that usually shows the displacement. And if they can, you want them standing up for this X-ray because you want their weight on it, and I'll show you why in a second. And they define it as an unstable joint if there's greater than 2 millimeters of movement in this joint. I'll show you what that looks like. So this is what a normal Lisfranc X-ray looks like on the Lisfranc. So you see this opening here, no real openings between the rest of the toes. Here's the big toe right here. You can see this widening right here. This is what the injury looks like. So you don't see the ligament on the X-ray, you don't see the actual tissue, but you can see the results of not having stability in that ligament, right? So this is way wider than that. So you can see a big difference there. That's what they're looking for. Here's another image, different foot. Left is normal. What they call a diastasis here, this opening, much wider on this side. So they're gonna look at both sides because some people have natural widening of that joint, just to compare right to left to see if it really is different. Can anybody see what's wrong with this foot? Definitely not supposed to look like that, right? So this would be example of like a motor vehicle accident or a fall from a height and they landed on their feet. Complete rupture, right? This is supposed to be here. This is not supposed to be pointed like that. These are supposed to be lined up over here. So this is complete dislocation, rupture, fracture. This person's going to need substantial surgery to fix their foot, and it's never going to be normal again. Sometimes they look at a CAT scan, they'll take a look and see if it helps define a fracture pattern because they're a little bit more sensitive to the fracture. But if anybody's ever had a CAT scan, you know you actually go, you're laying down for that. So your weight's not on the foot, and that's kind of like an important part of the test because you really want that weight bearing on the foot to really see if there's stability there. So it's of limited use. They do look at MRIs. They can look at specifically the Lisfranc ligament itself and see if it's continuous or not. If they suspect there's a rupture, they'll usually send you for an MRI, send the patient for an MRI to see what degree it's torn. And this is what it looks like here. So Lisfranc ligament, you see this white right here? It should be black. So the white represents fluid. So if there's a continuous amount of fluid, like a river that goes through there, that means there's no connection there. So that ligament is torn right there.
Does the ligament block it off?
Yeah, so if this ligament was intact, you'd see a black line going right across here. Because this is like part of it here, so you can see some hard tissue here. That's what it would look like right across there. All right, so they classified the injuries as stage 1, stage 2, and stage 3. So stage 1 would be a sprain, right? There's no tear in the ligament. You don't see any separation in the bones or anything like that. But they might have a little bit of separation in a weight-bearing X-ray, but they don't really have a lot of movement when you test it, okay? Stage 2 is there is an opening there now. It's about 2 to 5 millimeters what they measure on the X-ray. And you can see maybe there might be a little bit of a collapse in the arch. So if you have them standing, they might look a little bit more collapsed on that side versus the other side. Stage 3 is if there's greater than 5 millimeters and a collapse of the arch together. All right, and that's how they usually classify it. So if you have an athlete that comes in with a stage 1 Lisfranc sprain, you kind of know it's kind of like not that big a deal.